So you landed on carpal tunnel pain inflammation video. That means you have pain all the time and with all ranges of movement of the wrist. This way, that way, this way, that way. Now, it's important here to remember, if you had a trauma, or meaning like you fell, possibly fractured it, you want to make sure you cannot do this program without clearing out first that there's no fracture. So x-ray, visit your physician. Also, if you have a history of autoimmune, certain type of rheumatoid arthritis, they also were not for this program. These are best handled by a professional medical doctor. But if you don't have an autoimmune, you did not fracture your wrist, and like 2, 3, 4, 5 weeks later, you still have pain in your wrist, and it hurts all the time, and it hurts in all areas of movement, we have curated a solution for you, because essentially the key here is do not stretch and do not strengthen when you have inflammation of that kind, because then the tissues are not healing. In fact, you don't have enough collagen really in the tissues, meaning your ligaments, your fascia, your muscles to heal. So first we have to do is we have to make sure we give you the optimized situation where your tissues, muscle, bone, fascia can heal. And we have curated a group of supplements that we found through research, of course, not just clinical practice, that help tissue healing. There's a certain type of turmeric, there's a certain type of fish oil, and a certain type of magnesium. And I say certain type because it took us years to figure it out. There's certain companies that do things better, and there's certain doses you have to take. If you want more information, it's too much for this video. We have a whole video on inflammatory supplements, and they're really designed to help tissue healing. So that is a very important component of helping this type of pain. You can also find it on our website, MyKinetics 365. We have the whole kit. Now, other than the supplements, there's this thing, the ice kind of concept. Like, so rest, ice, compress, elevate, right? So rest, ice, compress, elevate is like, first question is like, what is rest? So rest is not like you lying in bed clicking on the remote control, because that actually will hurt your wrist. So it's active rest. You know, there's swelling. So think about it. You want to get the swelling out of the wrist. And movement is good for you. Like if you go walking around, if you can swim, if you can walk, you want to move, but you want to move in the pain-free range of motion. So let's say I start moving, whether I move my wrist a little bit or if I start walking, and I'm like, yeah, I feel my wrist, but it's really not getting worse. That's fine. That would be qualified what we call rest. Now, if you start doing some stuff and the pain increases, the more you do it, no good. You're actually causing more damage. Stop that activity. So the rest part is very important. You have to understand what it means. You can move, but you have to move in the pain-free range, or if you're moving, the pain should not go up. If it goes down, great. If it goes up, bad idea. So if you start stretching, you're like, oh yeah, no pain, no gain, and it gets worse the more stretching, you're causing, I mean, actually that's why I don't want you to stretch, because your tissues are not ready to be stretched. You don't even have enough collagen to stretch. So that's the rest part. The ice part is, get a lot of questions. Do I heat, do I ice? Look, if it's hurting all the time, if it's hurting all range of motion, forget about heat, get ice. Small area, it's not your thigh, so don't spend like 5 hours on this thing. You want 15, 20 minutes max. And you want to do it 3 times a day. And you want to get like, you don't want the ice directly on your wrist because it'll damage the tissue. So if you're using a bag of peas or something, just put a towel. Or if you go to the pharmacy, make sure it's like a gel kind of pack, and then again, put a towel around it. You do not want direct ice directly on your skin. 15 to 20 minutes, okay? The compressed part, this is where you're like, okay, remember, we got to get the fluids out of there, right? So you could use a brace, and there's all these elaborate braces and very, with metal and all this. Not necessary. All you want is a brace and or even an ACE bandage or some sort of a tape that keeps your wrist from here to here somewhat, supported. You don't want it tight because then it blocks the blood flow. Remember, we're trying to get the swelling out of there. So what I would suggest is like go to the pharmacy, sneak into the brace section or the tape section and play around with them. There's no perfect brace for this. We have a brand called Incrediwear. We don't make them, but you can buy it on Amazon. They make good stuff usually, Incrediwear. But the key here is whatever brace you get or however kind of elastic bandages you use, you do not want it so tight that your pinky cannot slip in and out very easily. So you put the brace on, you slip your pinky here in the front. If it goes in easily, you're good. You have support, but you're not getting blood flow. If you could barely put your pinky in there, it's too tight, you got to loosen it up. Okay? So these are the main rules of engagement when it comes to inflammatory type wrist pain. Now, if you do this, supplements, the RICE, the proper bracing, the proper resting, and you feel better, but it's not completely gone, we have a really good treatment, really, on our website, mykinetics365.com, because it takes you through, it holds your hand, it goes through this stuff here, but then it takes you to the next level. It's like, oh, you got to release these muscles, you got to strengthen these muscles, you got to take these supplements at this type, you got to, don't sit like this, don't move like that, move like that. So we literally hold your hand and take you through the program online, which is a program that's now been clinically studied here at the clinic in Beverly Hills for more than 15 years, that works pretty quickly to get you out of pain with the minimum amount of time possible. So check it out. If you're healed completely from this video, good for you.